Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I'm your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. It's so great to be with you today. In today's episode, we are just going to talk about how challenging it is to make the transition into dental hygiene school. Some of the top students who get chosen to have a seat in the dental hygiene program. You have to be one of the top in your class. You have to be a really strong student in order to meet the qualifications in order to get into school. So I typically work with first and second semester students, which I just absolutely love, because part of the challenge of dental hygiene school isn't just about the studying. There's just so much more going on internally that you really have to process in order to really develop into what it takes to be a good dental hygiene student. This is something that you've never experienced before. And until you're in dental hygiene school, that's really easy to hear, hard to understand, and really hard to implement. People say it's hard. Right. But then when you're in it, it almost gets overwhelming. So you can get that analysis paralysis almost. So this is what I really want to talk about. I want to talk about some of the things that I see as some of the big challenges that students face when they are in their first semester. So right now we're going through the interview process. I talked about that in last week's episode, was the interview process and, what to do to prepare yourself for the interview process. And then at the same time that that's going on in my life, the other thing going on in my life is that I'm working with students enrolled in the dental hygiene program in their second semester of classes and watching them have the challenges, face the challenges head on. And so I thought I would share some of the things that I see that tend to be repeated year after year with a new cohort of students. It just seems to be a common thread of challenges. The first thing is you're typically an A student or are used to getting really high grades on all of your assessments. You get accepted into the dental hygiene program and you come into the program and all of a sudden you are no longer an A student. You are getting C's, B's, and maybe even sometimes, dare I say, a D. That is a really hard pill to swallow because it's touching a nerve that you've never had touched before, because most dental hygiene students that I meet are high achievers and very used to getting straight A's. So they come into the program, they've used all the study strategies that they've learned up until the moment that I meet them. And maybe this is you, right? And then you take a couple of assessments, a couple of really challenging quizzes. Maybe there's even a case study in there. And you get your grade and maybe it's a 63 or something like that. And you're just like, what in the world? I've never actually had this feeling before. Why would I get a 63? I'm supposed to be a well-qualified dental hygiene student. Please know that that's normal. And there is an adjustment that occurs when you first come into dental hygiene school to figure out, okay, I need to, what's worked in the past is not working now. And maybe this is you I'm talking to, I'm not sure. But work with your faculty to figure out, where am I going wrong? What do I need to do to make some changes or pivot how I'm studying, how much I'm studying, what I'm studying, where I'm studying, and what I'm doing when I study, all the different things. Sometimes you have to do process of elimination to really get down to the nitty-gritty of what's going to work. And I have to say, one of the biggest pitfalls students fall into is they'll get this big stack of index cards and they'll just make a whole ton of flashcards. And the time that it takes you to make all those flashcards that, by the way, you're never going to look at again once you're done with that course and you move on to the next course. So that's a big waste of time. I would say flashcards are a really big waste of time for a lot of students. And every year I do the warning signs and the warnings of making too many flashcards. Just use the ones that your faculty make for you, or the ones that are resources in the library, or maybe previous students have taken the time to make. But don't take all your study time to make things like flashcards. And then think about some of the things that you think you know, that maybe you don't know in as much depth as you need to know. So there's a thing about dental hygiene school where you have to learn the material at a level of knowing, not just a level of, I'm going to take a test next week, so I'm going to cram all of this information in my brain. I'm going to take the test, and then about half of the information will be gone in the weeks following that. So that is something that is quite different in dental hygiene school, because you are going to be tasked with taking a board exam at the end of your journey. So you really have to have a knowing about the content, which is, different in some of your other courses that you've probably taken. This is content that you will use with a patient, and you'll have to recall that information right out of your head. And so that's actually quite challenging. Taking dental theory and actually applying it in the clinical setting with a patient and trying to recall that information in your head in the moment when you have direct patient care is so hard. So know that as you're learning, just take the time to really learn as you go. Not just to get a good grade on the assessment, to really become the best clinician on your journey to becoming a hygienist. The next thing I just want to address is all the lies that students tell themselves in their own head. And I'm reminded that we have 2 ears and 1 mouth. So it's very important for you to say the right things, because you have 2 ears listening to you. So it's very powerful in an exponential way what it is you say to yourself. I cannot tell you how many times, and maybe this is you, a student sits in my office to review an exam and they say, I'm just a really bad test taker. I understood the content. I just don't test well. Well, that needs to stop. You need to stop saying that about yourself, because if you say that and you believe it, that's actually going to be true. And you're not doing yourself any favors by saying something like that to yourself. So be kind to your test-taking abilities and get rid of those limiting beliefs that say that you're not good at taking an exam. Maybe you're not good at taking this type of exam in this moment, but you are in my office or sitting down with me to review that exam because you're getting better every day. And the next assessment that you take, you're going to be even more prepared because you're taking the steps to figure out where your challenges were. So I just want you to be really careful about the lies that you say to yourself that become your truth. And there is a lot of weight to that. So I won't get too far into that, but if you catch yourself saying, yeah, I'm just not really good at taking tests, or I go really, really fast because I just want to get it over with, or I go back and change all my answers and I had the right answer, but I just second guessed myself and I went back and changed that. If that sounds like you, I want you to kind of pause what you're doing and say, okay, if this is something that I think is true, recognize that it's really not true. It's just a lie you've been telling yourself, because you're capable of making a change and pivoting in a different direction with that lie that you've been telling yourself. And if the first thing to do is recognize that it's a lie, and then say, the truth is, I have to be more confident in my answer and not second guess myself and change it. I need to be more confident. It has nothing to do with test taking. Do you see how that's a pivot? If you go from saying, I went back and changed my answer, to, I just need to believe that I was right and stop second guessing myself. That will go a long way if you can identify the lies that you tell yourself and then turn those into the truth. The truth is that I rushed through the exam because in that moment, I don't like the pain and uncomfortable, overwhelmed feeling of being in an exam room. So I rushed through the exam to get that pain over with. Okay. So think about how once you recognize the truth, you can then say, But you know what? This is part of my journey to becoming a hygienist, and I need to put myself into that space and expose myself to the full amount of time that the professor has provided for me to take that exam and take the opportunity to read each question thoroughly, slowly, in a way that I understand what they're asking me. So it's not that I'm rushing through because I just need to get it over with. I need to relax a little bit, give myself the best opportunity to do the best that I can by utilizing all of the time. And my body is strong enough, and I'm strong enough to overcome that overwhelmed feeling of being in an exam. And I can go past that stress. I can overcome that stress to focus my attention on the test. Hopefully that helps you. And you know, guys, I have to say, one of the other challenges, man, hygiene school is just a different thing. You know, I have all the things that I've done, of all the schooling I've done, the hardest thing for me was dental hygiene school. And the reason why dental hygiene school is so hard is because you have to be really good at taking those tests. You have to be good at comprehending the concepts that you learn in your didactic courses. And then you have to take all of that information that's all jumbled up in your brain and use it in the clinical setting. And then you have to have really good coordinated clinical skills. And you're at first memorizing all of these different things like clock positions and how I use my instrument and the angulation that I have to have and all of these different things. And there's just so many things going on in your brain while you're trying to do all of that stuff and just access all the information. And it's all coming at you at the same time. And that's where hygiene school is different. There's this clinical piece that's really challenging, takes a ton of your time and a ton of practice. And at the same time, the demands on your mind to make sure that you don't forget anything and that you've got everything ready and that you're organizing and really managing your time well in the clinic. And then God forbid your patient asks you a question on your medical history that you're asking them and you don't know the answer to what they're asking you or something along those lines. It can be really stress provoking. So please know that that's all normal to feel that way. And your faculty is there to support you while you're going through that whole messy process all up in your brain. So it's definitely not an isolated thing. I think any dental hygiene student that you talk to would tell you the very same thing. Clinic stresses them out, even though clinic is where all the magic happens, right? That's where all the feeling like a real clinician happens in the clinical setting. But man, there's a lot of stress in there because of all of the things that you have to apply that you've learned in the didactic courses once you get in the clinical setting. And you don't have any of your notes with you and you don't have any cheat sheets with you. You're literally just flying by whatever's in your brain and trying to recall things, which can be really hard. So that's how hygiene school is different. I guess the question I'll pose to you is, what do you think you're going to do about it? Right? Where is your power? Because I want you to keep focused on the gratitude journey. I see students as they get going, they kind of forget that feeling that they had when they received their acceptance letter. And they're so caught up in the moment of stress that they have that they almost lose sight of how excited they are to be on this journey. And they're overwhelmed by the challenges that they face, the commitments that they have to make, and all of the limiting beliefs that are kind of holding you guys back. So what I want you to do is remember that feeling that you had when you received your acceptance letter. And remember the why. What did you say in your interview when you went in and they asked you, do you have what it takes to be a hygienist? Or what are the qualities of a good hygienist? Or whatever question they asked you about why you were sitting in that chair. Remember those feelings. Remember those words to help move you forward into developing into the person that you want to be when you receive your dental hygiene pin. Now, what are you going to do? What steps are you going to take? How are you going to pivot so that you can take a maybe not so good assessment or throw out all the flashcards that you've been making? How are you going to adapt so that you can move forward in the right direction in a positive way? without losing sight of your goal. You have what it takes to succeed, or you wouldn't have been accepted into dental hygiene school. And it's really up to you to figure out how to take the next step, and then the next step after that, and then the next step after that. The seeds of discouragement cannot take root in a grateful heart. That is a quote I said to myself every single day to get me through school. I hope that one helps you. And then my favorite quote, I have so many favorite quotes, I'm sorry about that. Little by little, a little becomes a lot. There was a time in my life that I was just like you, a dental hygiene student who didn't really know how to put all the pieces together, who wasn't quite sure of what the future looked like, who didn't quite know how I was going to cross the gap when I left school and work in private practice and look like a professional, like all the other hygienists out there that I had observed for years. I didn't know how any of that was going to go. All I knew was that my job was to learn everything to the best of my ability and do the best that I could to figure it out and keep growing every day. And that's really all any of us are doing every single day. But little by little, a little does become a lot. And before you know it, you will develop that confidence. You will reduce your stress. You'll feel less overwhelmed. And you'll look back and you'll say, I'm a little bit further. I'm a little bit further. I'm making it a little further down the road and a little closer to my goal all the time. And before you know it, you will have become the dental hygienist. So think about what you have control over and how you can take the next step in your journey in a way that doesn't make you or your family and loved ones crazy as you're going through it. There's no need to be overly stressed. It all unfolds and just happens. It really does. And you're going to grow through your journey and go through your journey, but you want to make sure that you're enjoying that moment as well. And that can be really hard when you have additional stress of things like exams and requirements and all the things. But at least one time in this semester, look around the classroom or look around the clinic and look at your classmates and say, we are doing it. In your mind, just take a moment to do that and really appreciate how much you've done to get to where you are in that moment. All right? I hope you guys have a really great week. Tell your friends about the podcast. That's my one ask for you, is to share this with a student friend or a good friend so that they can listen and get the benefits out of it. I really appreciate you being with me. Take care, guys.